Labour Party launched a defamatory smear campaign on Nigel Farage in a desperate bid to quash the support for the Reform Party. Well, that's what it looks like. Now, I am used to random left-wing idiots on Twitter posting completely untrue and unfounded claims, but the official Labour Party Twitter account posting this complete and utter garbage. It is complete and utter lies. It is defamatory, it's libelous, it's just completely false and has absolutely no evidence whatsoever. Right? I expect a bit better from the official Labour Party. Yes, I do not regard the party highly, but I at least expect an official party to think a little bit about whether there is an ounce of truth to their claims before they post it. So they've been posting up these posters on Twitter, right? It says, "Our public services are not safe in Nigel Farage's hands." And it says, "Could your family afford to get sick under Farage?" And then they put these various figures. Where have they got these figures from? It says absolutely nowhere in the reform literature that it's going to cost this amount of money to go visit a GP, to go get an appendix removal, right? What they've probably done is found out what the cost is to get these things without any insurance in the US, probably converted it to pounds and then put it on their poster to put like the worst case scenario, right? This is genuinely beyond belief, and it is just completely false, right? Reform are not saying at all that they want people to have to pay for the NHS. Okay, they would never say that, because that would be like political suicide. Okay, and I just can't believe this, right? They are trying to convince voters that you will have to pay nearly 11 grand for an appendix removal if Nigel Farage gets into number 10, or 129 quid for a GP visit. It's completely and utterly baseless. So, I mean, what have they tried to base this on? Here they've got another one that they've kind of tried to make like a news article. It says Reform will scrap the NHS and replace it with private health insurance, with a broken arm that says you owe money, right? And you've got this Labour MP saying the media are catching on, reform is at a risk to hardworking people and our precious NHS. Farage rejects British values. Okay, so what is this all based on? Well, you can see on that front page that is in the picture there that Farage said we are going to have to move to an insurance-based system of healthcare. Okay, that does not mean that people have to pay for the NHS. Okay, you can introduce private companies and insurance-based systems whilst the government gives you money to pick the provider, to pick the insurance that you want. Okay, Reform has said at no point whatsoever that people are going to have to pay for the NHS, right? And here's an idea for Labour, right? What if you do have an insurance-based system, and I'll show you in a moment the detail of exactly what that can look like, right? If it is the case that you have an insurance-based system and the government gives money, gives vouchers to people who are on lower incomes so that they can choose brilliant private healthcare, they can choose a private provider that gets them a GP appointment way faster than the NHS, right? And the rich people have to pay themselves rather than the government having to pay for them. Why wouldn't you like the idea for that? You can have two systems, right? You can have a system where you have insurance companies and the government gives everybody vouchers to pay in full for the insurance that they want, or you can have a system where you have private companies and the vouchers are just given to people who are poor. The money is focused on those who need it. They get way better healthcare than the NHS. And then people who are in the middle, they have it partially paid for by the government. And then people who are rich and are billionaires, well, guess what? The state doesn't have to pay for them. They have to pay for themselves, right? Both ideas should sound good for Labour. You know why? Because fewer people die, okay? If you look at other countries that have different models of healthcare than this socialist bullshit that we have in the UK that doesn't work and is on its knees, right? Way more people get to live. Okay, you don't have all of these unavoidable deaths, right? People actually get treated quickly and effectively if they get something horrific like cancer, okay? Because there is a little bit of healthy competition. It's not the US, Okay, the US is a mess, but there are so many other countries that are doing a far better job at keeping people alive. Shouldn't any government, left or right, want people to stay alive? But apparently the Labour Party doesn't, and they just want to launch a complete smear campaign against Farage and sell a complete and utter lie to the public that you're going to have to pay for the NHS under the Reform Party and pay 11 grand to get an appendix out, or 130 quid just to get a GP appointment. It's total bullshit, and they know it, but they are literally clutching at straws, and they're desperate because Reform are doing well in the polls. So let's actually have a look at the Reform contract. What does it say about the NHS? Does it say you're going to have to pay 11 grand to get an appendix out and you're going to have to pay for the NHS? No. Okay, so it says that within the first 100 days, if Reform were to get into power, they would end doctor and nurse shortages, use independent healthcare capacity. We will harness independent and not-for-profit health provision in the UK and overseas. Tax relief of 20% on all private healthcare and insurance. A great idea, right? That is using more private providers and more insurance-based systems, right? They do this in Australia to great effect. Okay, in Australia, if you decide to get private healthcare, so if you decide to get the equivalent of Bupa, right, you will get a tax rebate. You'll get some money back because you've saved the state some money by not using the resources in the NHS. But you know, too scary for Labour, right? You can't possibly suggest that. They'll say that you're taking away the NHS and you're scrapping the whole thing, right? And then it says they would put patients in charge with a new NHS voucher scheme. NHS patients will receive a voucher for private treatment if they can't see a GP within 3 days. For a consultant, it would be 3 weeks. For an operation, 9 weeks. Services will always be free at the point of use. Do you see that? Always free at the point of use. But we're talking about vouchers, okay? So we are talking about private companies that have insurance-based models, right? They will exist. They will be operating. Will you have to pay for them? No. Okay? You can give someone a voucher to go to a private practice. I actually, in the NHS, there is a teeny tiny amount of this. So I use a system it was called GP at Hand, it's now called eMed, right? Where a private provider is providing NHS services. The NHS has paid a private company, right, to do the GP appointments and whatnot, right? It's free for me, it's completely free because it's under the NHS, but the NHS has paid them to do their job for them, right? And for me, it's great. I get my appointment way quicker than I do if I were to go through the normal NHS, right? I do not wait 2 months for a GP appointment. I can get one the next day under this system, right? And you go in there, and it's often in the same building as Bupa, their surgeries, right? It's very nice. It's much cleaner. They're pretty plants. It feels nicer. Service is great, right? But I am not paying a penny. So this is already existing to a small extent. It should be rolled out much further. Okay, people should not have to wait 2 months for a GP appointment. But Reform, they suggest this kind of stuff. Oh, we'll give vouchers so people can use private companies. What does the Labour Party do? You're going to have to pay 11 grand to get an appendix out. Reform are scrapping free healthcare. No, they are not. Okay? Amongst other things they want to do, improve efficiency, cut waste, unnecessary managers, think that speaks for itself, sort out A&E, excess deaths, and vaccine harms public inquiry. As I said, I mean, I haven't touched on the vaccines, but excess deaths, so many people are dying on our NHS who should be alive because they could not get treatment fast enough and effectively enough. Okay, because the system is on its knees. It needs to change. Reform has suggested something reasonable, and the Labour Party are doing this ridiculous campaign with it, it is just an outright lie what they are saying. I don't know how they can get away with it. I think it's defamatory and it's an outright lie. And I just want to show, they're doing this because of polls like this coming out. This is just another one that we've had out. We've had plenty more like this. Reform in the lead, 26%. Labour falling behind on 23%. They are desperate to do whatever they can to quash Farage's support. But I do not think outright lies are the way to go about it. And just to, if you guys aren't aware, I've spoken a little bit here about the kind of other systems that are available to us that we could use that are used in other countries. I just want to show you this description of what social health insurance is. This is from Christian Nemitz at the IEA, who's done. I really suggest you go and read it. This paper that I've used for years, that I think is very important and people should read and understand the options we have. It's called Universal Healthcare Without the NHS. If you Google it, you will find it. But this is just gives you an idea of what a social health insurance system is. Okay, so they have this in Switzerland, Belgium, the Netherlands, Germany, Israel. Okay, it's not like we just have America's mess as our only other option. Like the NHS, social health insurance systems also achieve universal healthcare without the NHS, albeit in a different way, namely through a combination of means tested insurance premium subsidies, community rating, and risk structure compensation. Unlike in the US, there is therefore no uninsured population. Even homeless people have health insurance, and there is no such thing as medical bankruptcy. When it comes to providing high quality healthcare for the poor, these systems are second to none. In this respect, there is nothing the NHS has achieved which the social health insurance systems have not also achieved. So if you didn't get the gist there, you've got these countries, there is a means tested system, right? So you will get vouchers from the government. You may have money put into like a medical savings account, or you may be given a voucher, whatever form it comes in. If you are homeless, if you are poor, you will receive the money from the government to pay in full for your private insurance. It's heavily regulated. It is a legal requirement to have insurance, so there is no uninsured population, right? You could have it like this, where it's means tested, or you could have a social health insurance system where it's not means tested and everyone gets a full voucher from the government if you want to make sure it is completely free for everyone. But we see in these systems that the healthcare available is a heck of a lot better than what we have in the UK, and people do not drop dead all the time. They actually save lives in these systems. Isn't that what everybody want? If you look at the like cancer survival rates, which is also in Christian's paper, in these other countries, oh my god, it is so much better than the UK. You will realise what a mess this country is and how many people are sadly dying who really do not need to. Anyway, I'm Chloe Dobbs. Thank you very much for watching. Subscribe to Reasoned if you haven't already.